Animal Experiences in Animal-Assisted Intervention, presented by Christine Hellstrom, occupational therapist. A great deal of research has been completed over the years with regard to the physical and psychological impacts of AAI on the human species. However, it's also important to take into consideration the experience and impact of the interaction on the animal partner. What about the animal? Human understanding of learning theory with regard to training animals has changed significantly over time. Traditional training methods relied heavily on aversive stimuli, such as positive punishment or negative reinforcement. However, these types of training methods tend to have a negative effect on animal welfare and can result in pain, suffering, and display of undesired animal behaviors. Physical punishment, such as the use of harsh verbal reprimands, shock collars, or physical punishment, can lead to compromised animal welfare, including inducing anxiety and fear. Food deprivation, spraying an animal with water, and hitting or squeezing an animal can result in a display of problematic behaviors and can even lead to weakening of the animal-handler relationship due to lack of trust. More recent research provides evidence that methods of training focusing on positive reinforcement, desensitization, and heightened sensitivity to the animal's displayed behaviors will result in improved trust and desired behaviors during AAI. When focusing on positive reinforcement as a training method, it allows the handler, practitioner, and patient to build trust with the animal, with desired behavior as an end result. Positive reinforcement during AAI, such as offering a treat in response to the animal allowing the patient to gently pet him during a session, can result in a positive welfare state for both the animal and the patient. It is also important to understand the categorization of types of AAI. Practitioners and handlers need to understand the types of qualities and skills that an animal can bring to a session, as well as determine the overall goals of the intervention in order to appropriately choose a qualified and appropriate animal partner. Sessions in which the goal is for the client simply to direct their attention outward can be fulfilled with the partnership of animals such as fish or caged birds. This type of interaction is called implicit. Sessions in which the goal is for the client to demonstrate simple contact with the animal and the animal assists with enhanced rapport, focus, outward attention, and sensory or cognitive processing is called explicit AAI. Appropriate animals would be a bunny rabbit, a cat, or even a guinea pig. Sessions in which the client and animal participate in directed activities and interventions together, with the animal being an active therapeutic agent providing opportunities for meaningful interaction, would be considered instrumental AAI. This intervention is focused on skill building and developing and/or practicing new behaviors. Animals appropriate for this type of intervention would be a highly trained dog. It is always important to remember that not all animals are appropriate partners during specific types of AAI. While a dog may enjoy partnering in a social interaction with a very loud, very excited child with autism spectrum disorder, a cat may experience the same interaction in a negative or anxious manner. It's also important to choose the breed wisely. For example, a highly trained golden retriever may be an appropriate breed of dog to partner with a child, whereas a tiny chihuahua may be intimidated or overwhelmed by the interaction. The same chihuahua may absolutely love interacting with elderly men and women in a nursing home setting. It is of utmost importance that the animal handler understand the capabilities and preferences of the animal, and to decline any interactions that may be anxiety or stress-inducing for the animal involved. This will not only protect the well-being of the animal, but will result in optimal therapeutic benefits of intervention. The handler needs to be fully aware of the animal's behavior and characteristics of the species and the specific individual animal prior to implementing the AAI sessions. Social elements in AAI can also significantly influence intervention outcomes, not only for the client, but for the animal involved. For example, some species of animals are social by nature and are amenable to human touch. This interaction can lead to positive emotional, psychological, and physical intervention outcomes for both the animal and the human client involved. It is of utmost importance that the animal be cared for at all times, to include before AAI sessions, during AAI sessions, and after AAI sessions. The animal handler should always be cognizant of the welfare signs of the animal involved. At any signs of stress, anxiety, agitation, fear, or fatigue, the animal should be removed from an intervention session to protect the state of well-being for the animal and the client involved. The protection of the animal will result in increased animal handler trust. Animals that have high level of trust with their handler are more likely to be receptive to human-animal interactions, which result in beneficial therapeutic outcomes. Handlers are the voice of the animal and must appropriately advocate for animal needs and well-being. Social needs of the human client should not overshadow the needs of the animal. If the animal needs a break from the intervention, needs the sessions to be of a shorter duration, is demonstrating signs or behaviors of being uncomfortable in the therapy environment, or just needs a chance to participate in normal behaviors, it is the role of the handler to intervene. Thank you, and I hope you enjoyed my presentation.